Hi, this video is the art of hair transplant restoration surgery on a client who had a procedure around 25 years ago with resulting to plugs and the hairline is really high. His goal is really to not lower the hairline that much, but to increase some of the density. So because we're doing the FUE, I'm not sure how many grafts I can pull out today, 2,000 or more. And he's really didn't from front all the way toward the back. So we trying to achieve his goal, yet at the same time trying to fix the hair plugs and give him a little bit more better hairline. So we're not going to lower the hairline as low, like from the mid eyebrow to the hairline 6.5 or 7.5. This hairline actually a little bit 8.5 centimeter, almost toward 9. Why we don't want to lower too much? Again, because we're limited number of grafts we can do today, and it's around 2,000 grafts or a little bit more. And the other thing is our goal is trying to fill in the front part, and that's his goal. And so with that in mind, how to fix the plugs. So the plugs has, make a hole, put like 10-20 roots in. That's why I have those mini plugs. There's 3 techniques to fix it. One is they excise and cut it out, but that is old technique. It leaves you that linear scar, very hideous and too invasive, numbness and all those stuff. So we don't want that method. The other method is just putting transitional zone in front. So leave the plug and just transplant hair in front of it. That method by itself doesn't work that well. A combination method is the third method, and it's combined building transitional zone. But before we build it, we just thin out the existing hair plugs first, and then build the transitional zone in front of it. By doing that, the plugs doesn't look too harsh, because if you just put the transitional zone in front without thinning the plugs, there's a big contrast, because the FUT, not FUT, but it would transplant one root at a time. With root, it looks different. There's a big contrast. But if we thin it out and build the transitional zone, then they hide better and will give you better result. And that's my goal to do. And and the hairline is way too high. So we're at the same time trying to lower the hairline and fix it at the same time. Again, this is normally around mid eyebrow to the hairline, 8.5 centimeter for Caucasian, more narrow face with archback. And you see his tempo has gone back, it's straight down. But we had to build it in a little bit, and depending on how many grafts we do. The goal of the tempo is not really to have density, but really frame the face. Otherwise, the forehead is too wide and too high. So we're trying to bring it down, give him a more natural look. I'm very excited, because if I can get above 2,000, we're going to do quite a bit of coverage for him and make him look much